Thank you for joining us. My name is Karim Kanji. I'm happy to be your host for today. For those of you who are watching, we'd love if you could subscribe to our YouTube channel. Go to youtube.com/xconnecttv and please subscribe. If you're on Facebook, follow us on Facebook. Facebook.com. Actually, it's like us on Facebook, isn't it? Like us on Facebook. Facebook.com/xconnectto or follow us on Twitter @xconnectto. I'm excited to chat with a good friend of mine, Nikolai. Radkowski, how are you?
Great.
I screwed up your name there, didn't I? Radkowski.
Yes.
Yes, fantastic. Thank you for joining us. Really appreciate it.
Thank you.
You're just coming back from Montreal, part of the Founder Fuel cohort.
Yes.
Yes. And you went with your company, HealthAware.
Correct.
So why don't we do this? Why don't you talk to us a little bit about HealthAware? What is HealthAware.ca all about? What are you guys looking to do? What are you guys looking to disrupt?
So HealthAware is an online destination that takes the pain out of health appointments.
Mm-hmm.
And in a nutshell, we help you find health practitioners, see their availabilities in real time, and book an appointment instantly.
Okay, so any sort of health practitioners? Are we talking doctors, dentists, really massage therapists, anyone? Or
So right now we're specifically targeting private sector in Canada. So that would be massage, chiro, physio, dentist, optometrist, so whoever is paid by insurance or out of the pocket in Canada.
Mm-hmm.
And public sector is definitely on the map, but it's a slightly different play because public healthcare sector in Canada is what's the right word? It's a bottleneck in a healthcare system. We are overbooked, so our business model is only partially applicable to what to that scenario, but we have some interesting strategies around that as well.
Awesome. Well, let's talk about these strategies. What are your strategies to get into the public health sector?
So the public health sector, we are looking at several EMR players that we potentially will integrate with and provide them with a free online scheduling platform that will allow to drive efficiency to their front desk. Right now, their front desk is overwhelmed with all the appointments that are coming in because all of them are booked up like months in advance.
Yeah.
So we can fix the efficiency problem, but what we really like, the space we really like playing is patient acquisition space, and that's where it's very applicable in private sector. So when you go to a dentist or chiropractor, all of them want new patients. And when we look at US market, the whole US market is a private sector. Yeah. And anyone from a family doctor to a dentist are looking for new patients. For more patients. Exactly. So that's why there is a slight disconnect with public and private in Canada, but in US that goes across the board. So,
a quick glance at your LinkedIn profile, and you've co-founded 2 other companies. What was the impetus, and I want to talk about those 2 as well, but what was the impetus behind starting HealthAware? What sort of thing were you bored with at home or with where you were working? They said, I need another kick at the startup can.
So I've been in the healthcare space for like the past 8 years. And
what have you been doing? Like what's on the technology side, I'm assuming?
Yeah, it was mostly health informatics, and one of the first companies after my software development business, it was SIMS, which is medical imaging software as a service. So what we've done, we put radiology and cardiology and cloud, and allowed for cardiac and radiology centers for more efficient operations. And that business was doing quite well, and then basically we've packaged it up so that it runs on its own and keeps growing, and it is still growing up till this point in time. And I basically started looking around and see what else can I do, and I was like, I really understand healthcare.
Yeah.
So
interesting. And that almost seems to be the entrepreneurial dream, right? To start up a company, don't necessarily need to sell it, still have it, still pumping out income for you guys. And then you figure, okay, I've spent enough time on the beach.
I should have spent a bit more time.
I know you like skiing as well.
Yeah.
So a bit more time on the ski hills.
Yeah.
And you decided to start HealthAware. I'm very curious. 2004 seems very early for this whole conversation about cloud technology and utilizing that. Tell me, how was it building SIMS and communicating
So
that service or that solution.
yes, at this point in time, there was no terms as software as a service (SaaS). Everybody used to call it ASP, application service provider.
Yeah.
And we were definitely the first guys in Canada putting medical data in radiology field in the cloud, and it was very interesting. Like, it was just the beginning. The whole thing cloud. Nobody was saying cloud. It was just hosted on the service. Application was hosted on the service, and we were the providers of this hosting. So, and it was at the same time very tricky because the internet speeds were not at the same place where they are right now, and we were pushing huge medical imaging files, like massive. And we're first version of software. It would took for radiologists probably like a minute to view a file. And 1 minute of radiologist time is worth like hundreds of dollars. So it was a bit tricky, and we started improving in technology, and then we nailed it, and it started doing well, and
Awesome. And then you started, 6 years later, you start the idea of HealthAware.ca. And so what was it that said, you know what, we need to start up this solution? There's, the health industry, did you think about, the health industry, there's a lot of opportunity there. What was the thoughts, the discussions you guys had?
So, HealthAware came more from a personal problem.
Okay.
And I was basically like looking for a family doctor. I thought, I haven't done like a checkup for like years. Time to go see if I'm still gonna live another 80 years as planned. And I couldn't find one. And then I started poking around the idea, how do I make it much easier? And there were some resources online, but you had to go through multiple resources, call a bunch of people, call a bunch of clinics, and it's still a problem here in Canada. And we've had some folks at solving that, and we realized it's tough to monetize that, and it's a tough problem to solve. But then at the same time, I think it was a year later, I needed a dentist because we were in a new area, and I realized, well, dentist is kind of private sector, should be easy, and it was as similarly complicated as a family doctor. They would take you in, but then first you gotta find who's around, who can see you right away, or the convenient time for you, who is good, who is not, and then once again you're going through multiple resources. Then you're calling the clinics. Some of them would see you the same day, but if you find them, some guys would be booked up for a week or so. And so it's like, wouldn't it be nice to have everything in one place? You go there, you tell them who you need when it comes to your health, and you see all the practitioners around you, and you see their availability in real time. So now you got all the tools at your hand, and with one click and like less than a minute, you can get yourself any kind of an appointment. And as you touched on, I like skiing, and one problem that I constantly find myself in especially after when you're just getting into the season, after a day of skiing, you get back and all the muscles are gone, like they're hurting so much that you can't even move. And it's like, I want the first appointment to see a massage therapist. And how do you do that right now? It's an hour
online searching.
It's a couple hours engagement.
Who's available, and you're juggling that. Do I go to the one that's close and wait a week, or do I go to the one that's far and see them tomorrow? And how do I even find these places in the first place? It's very interesting. Now a little step back, so Sims, you started HealthAware, but also in between there, you kind of departed from health. It seems, and you went into Green Scroll, and here at X Connect and by Third Ocean, personally we know Johnny Carson, who I guess is your co-founder, as well in that. How did talked about what is Green Scroll all about, and why?
So Green Scroll, it was something on the side of my passion, and the whole ideology of all this new renewable energy coming into play. And so Sims was already generating money and was starting to do well, and I was so how do I give back to the community? And really wanted to do something with renewable energy, was looking into that space. And one thing we ended up doing is we decided to start a nonprofit that helped anybody with online presence to make their online presence environmentally friendly. One thing that people don't realize is that emissions generated by data centers bypass the aviation industry, and the number is growing super fast. So all the power that data centers draw to power the internet, to power all the online properties, the websites, and etc., are generating, like, are powered by brown power, which generates a lot of emissions.
Yeah.
And with this thought in mind, was like, so how do we make internet greener?
Sure.
And so we started Green Scroll, which is a nonprofit that helps you to offset that consumption of brown power with renewable energy. So you would pay, based on the number of page views, we would estimate how much electricity is consumed, and we would buy on your behalf wind or solar power to offset the consumption of your website.
Interesting. Very interesting concept there. And how is that coming along still?
So we've been on this full time for a couple of months. It was a kind of transitionary project, and it was more of a passion for all the three guys in this. John and Alex is another co-founder. And now the system is completely automated. People are still signing up to the service. We take zero fees on all the money that we get. It goes directly into green energy. And the service is growing on its own, and it's
interesting. So let's get back to HealthAware.
Yeah.
It's a little bit of a journey. It's 2 years since you started, since the idea, since you guys started building it. What's happened between 2 years ago and a few months ago prior to going to Montreal for Founder Fuel?
So a lot of things actually happened. So HealthAware wasn't called HealthAware, first of all. It was called Health Kiwi.
Okay.
And
Health Kiwi.
Yeah.
Okay.
Gen Y loved the name, and our demographic, which is 30 plus females, were like, "Are you for real?"
Really?
Yeah. There was like, "What is this?"
Okay.
So we had to rebrand, and originally HealthAware was kind of stabbed at my first problem of looking for family doctors and trying to play around that. It was more of a directory, more of a public sector, and then there was a few pivots from there, and we ended up with what HealthAware is today. And we've also, while building HealthAware, we've actually built another successful business in parallel as we were looking for a business model for HealthAware.
Okay.
So we understood that there is a need on both sides. We weren't sure what's the best way to monetize it. So while we were doing that, we stumbled upon something in green and renewable energy.
Yeah. And
we built a lead generation business for renewable energy here in Canada, and it grown quite quickly. Like over 2 months, we were #1 lead generator in Ontario. And it was called Market Aware, by the way. Kind of simple take on HealthAware, and just so
keeping it all in the family.
Exactly, and that opened our eyes on a few different interesting business models, where like performance marketing and etc. And we reapplied what we learned in HealthAware, and then we took. By then we had a solid prototype built, and we launched that in September 2011 was the first 20 pilot clinics, and we realized people are really liking the service. Patients are like loving the convenience of booking appointments online. Clinics loving the ability to get new patients, as well as the efficiency that it gets them. So we're like, okay, we have to build that. And that was really the first MVP. It was like a lot of stuff was manual. Because like people on the phone, you got an appointment, there was like no automated reminders, and even like our sign up process was actually a paper contract. So we would send a paper contract to
use like a fax.
Yeah. And they would fill it out with their credit card number, they would fax it back, and it was like,
Amazing.
It was crazy, and it started picking up. We couldn't handle all the stuff, so we had
And this
to
from a tech guy who started the cloud before the cloud was
yeah. But at the same time, I was very into lean startup methodology, which was like, minimum viable product, prove that people want it.
Yeah.
And that was a good stab at it. And,
Nice.
Yeah.
So tell me about the business model. How does that work?
So business model, we've iterated on few, and right now what we're doing it right now it's a freemium.
Okay.
So for patients it's free, for health practitioners to join it's free, and then we get into different premium subscriptions. And there are premium subscriptions around two main areas.
Okay.
One around patient acquisitions and one around efficiency of communicating between patients or properly managing patients as clients. And depending on what they're trying to achieve, what their goals of the clinics, we would provide a different package that they would pay a monthly fee for.
Okay.
And which will either help them to acquire more patients or help to improve, to decrease cancellations, increase show-ups, referrals, and etc. etc.
Now, with HealthAware, you just went to Founder Fuel, helped you to, you said in an earlier conversation that we had, really understand your business better, understand what you wanted to communicate from that as well. Where do you see the company going? By the end of this year, what sort of goals and objectives have you guys set out for yourself? Where would you like to see it going?
By the end of 2012?
Yeah.
2012, we definitely aiming to be the number one player in Canada. We are already the number one player in Canada when it comes to.
Are there a lot of other companies?
There are a few other companies much smaller in size, and other people are trying to play in this space as well. We're far ahead, and with the current state of our company after Founder Fuel and all the financing that's coming in, we're definitely going to be the player and the destination in Canada when it comes to healthcare. And then from there, of course, is looking at US market, and we're already having some conversations about that. And the reason I was on the phone there was talking about some big partnerships in states.
Fantastic.
Yeah.
Well, let me ask you a question. Every time someone sees the .ca, they automatically assume, just Canada, not US. Are you? Does it matter to you at all?
So .ca, it actually does matter.
Okay.
And we got a lot of crap from inventors and investors about .ca.
Yeah.
And we realize the issue with .ca, we actually own several .com domains which are not HealthAware.com, but like myhealthaware, gohealthaware.com with like transitionary domains.
Okay.
.com is actually available and for sale. We just believe it's not the right time to spend the money on acquisition of the domain while we're building the traction here in Canada. And it's definitely we're discussing something with the seller of a domain. And we have that under control. And .ca is very important when you're building traction in Canada. And people, because there's so many US-based services that are coming to Canada and have very small coverage and small presence here, and Canada is almost like kind of leftovers. It's there. Whereas here, .ca demonstrates the commitment that it's our market. We know it, we understand it, and we're actually quite expanding quite quickly. So it gives us this advantage in our backyard, but at the same time, we understand US market, and we're looking south of the border every day, and that's the place we will be. But Canada is something that we can easily own very quickly, and then start playing in US market with already a successful business here, which is generating money.
And I'm very curious, at the beginning you were calling up clinics.
Yeah.
How is the customer acquisition today? What sort of tools and methods are you using to spread the brand and to have other clinics sign up, to have other people interested in getting them on board?
So we have a spectrum of strategies that we use to acquire clinics, and two main areas are generating inbound leads directly from the clinics. It's a more of a marketing problems, but we have some exploits around there as well. And the second main area is large partnerships and channels.
Mhm.
So we're working with medical associations. We're
Okay.
working with large groups of clinics like LASIK, Centric Health.
Mhm.
Um,
And they've got like a network of,
Yeah.
of these locations.
they have hundreds of locations, thousands of practitioners across
Mhm.
Canada. At the same time, we're working with software vendors that provide solutions to those clinics.
Mhm.
And we have several strong partnerships where we become the online booking platform for those software vendors. And all that is, you will see all that being rolled out over the next few months as we're finalizing the deals and all that.
I look forward to that. Well, one last question, Nikolai, before we wrap up. You're a young guy, you've started a few businesses, you've been successful, you're presently building another, hopefully successful business right now. If there was one tip that you could give to a young entrepreneur who might be watching this, what would it be?
One tip.
Yeah.
I think one thing I would say is be persistent. If you're passionate about something and you want to do it, there will be a lot of naysayers. People will be basically knocking you down and telling you, well, there's a hole in the idea here and
Mhm.
there. Listen to them, but be very smart of what you take out of that.
Mhm.
But be persistent. Like the first business, not that it wasn't the first, since the medical imaging software, in 2008, we were $250,000 in debt, couldn't meet the payroll. We
Wow.
were bankrupt, basically.
Wow.
And it was a Christmas day. We're having a meeting in the boardroom, and we're like, we have negative $250,000, and there's no more cash. What do we do? And we managed to restructure company, pulled out, and in less than a year and a half, we broke even and we became profitable. But we almost walked out and closed our doors, but we said, you know what, we're going to live through this, we're going to make it happen. So same thing here. Entrepreneurship, it's not about building a company, it's not about running a sprint, it's
Mhm.
about running a marathon. And you got to really pace your energy and you got to be smart about what you do and you will be successful.
How do you know who to listen to? How do you know when to listen to your gut? How do you know when to, listen to someone who's giving advice or when not to listen to? How do you, is it just experience or how do you determine that?
So I guess the simple formula that we worked out for ourselves, first of all, ask why, at least 5 times.
Mhm.
Why is this person saying that?
Mhm.
Where is this coming? Why? What does he mean?
Mhm.
Analyze that source. Where's it coming from?
Mhm.
And understand how much does the person knows about the industry and your business. If you can get that, then you'll really start understanding the value of advice. Because I'm kind of guilty of the same thing when I mentor other people, and
Mhm.
I'll tell them you should be going this direction, and I'll be very persuasive about it.
Yeah.
But in reality, I thought about their business only for 5 minutes, and I have no idea
Sure.
about their industry. But it happens, so that's why you really want to understand that. And second, definitely it's your gut. You got to be. You're working on this business day and night. You're thinking about the business day and night. So combine those two, analytical and a gut feeling, and see where it takes you. And you have a passion, you have a vision. Make sure it also aligns with what you're willing to do. If somebody's telling you, well, you should be taking 180-degree turn, and it takes you into something that you will not be happy about and you won't be passionate about, you'll never succeed at that, because you'll never be able to put all the energy necessary to make it successful. So that's another important factor there.
Fantastic. Appreciate all the advice. And, where can people find out about you, find out about HealthAware online?
HealthAware.ca.
Awesome. Thank you so much for joining us.
Thank you.
Really appreciate it. Thank you guys so much for watching. Again, my name is Karim Kanji. You can find me on Twitter @Karim Kanji. Go check out all our interviews, articles, white papers, reports at xconnectto.com. Like us on facebook.com/xconnectto. And you can also follow us on Twitter, xconnectto. Thank you so much for joining us. We'll chat with you soon.